All right, hello everybody. We are in our second debate for the summer of 2024. Today's topic is the use of AI in therapy. In this scenario, a psychologist is using an AI-based therapy app to enhance their sessions, and the app's CEO, a patient, and the psychologist are seeking insights from a mental health researcher, a psychology professor, and a practicing psychologist as well as a pharmacist, to speak on various aspects of AI therapy. Are such technologies needed? In what situation might they be best used? And in what situations might they be avoided? So Team A has the CEO of this mental health app, the psychiatrist who uses an AI therapy app, and a patient who has sought help through both traditional and AI-driven therapy. Team B is a mental health researcher, a psychology professor and practicing psychologist, and a pharmacist. All right. Team A, could you lead us off?
Sure. I'm the first speaker. So, hi everyone. As the CEO of a leading AI therapy service company, I speak before you today to advocate for the transformative potential of AI therapists and virtual counseling. Our mission is to revolutionize mental health care by harnessing the power of AI to provide accessible, affordable, and effective therapy for everyone, everywhere. So, at the heart of our company's vision is the belief that mental health care should be accessible to all. Traditional therapy often presents significant barriers, whether it's the need to travel to a physical location, adhere to strict schedules, or endure lengthy waiting periods. But our AI-driven platform eliminates these hurdles. It's available 24/7, and our services ensure that individuals can access mental health support whenever and wherever they need it. For those in remote areas or those with physical disabilities or those whose lives just don't align with traditional therapy hours, AI therapy can offer them a lifeline, ensuring that nobody is left without support in their time of need. We also understand the financial strain that traditional therapy can place on individuals and families. So the high cost of therapy often deters people from seeking the help that they need. So AI therapy solutions are designed to be affordable and hence can reduce the financial barriers that prevent many people from accessing mental health care. So by offering services at a fraction of the cost of traditional therapy, we aim to democratize mental health support, making it available to a much broader population. Another significant advantage of AI therapy lies in its ability to deliver consistent and objective care. So human therapists, despite their best efforts, are often influenced by their own emotions, experiences, judgments, and biases. So our AI system, however, operate purely based on data and algorithms and have the potential to provide more consistent support in every session. So this ensures that each of the clients receives the same level of care and professionalism, regardless of when or how often they engage with the service or the day that the therapist has had, for example. I'd also like to talk about scalability and reach. So our AI therapy platform is built to address a pressing global need, the shortage of mental health professionals. So demand for therapy services is growing exponentially, and the current supply simply cannot keep up. AI therapists offer a scalable solution capable of reaching millions of people simultaneously. This scalability is especially crucial in regions where mental health services are scarce, allowing us to extend our reach to underserved populations across the globe. I come from India, and although there are increasingly available therapy services now, they're nowhere close to the kind of services we have available here in North America. And I believe that AI therapy is something that can help that out, even if it's a little bit. We also recognize the importance of personalized care, and our AI therapists are designed to provide just that. So by leveraging advanced natural language processing and machine learning, our platform tailors each session to the individual's unique needs. So our systems analyze data from previous sessions of the same patient, identify patterns, and offers insights that can potentially be missed by human therapists. So such a personalized approach ensures that our clients receive therapy that is not only effective, but also continually adapted to their evolving needs. Lastly, I want to emphasize that our goal is not to replace human therapists, but to complement them. So AI solutions can handle routine tasks, provide initial support, and serve as a bridge between sessions with human therapists. So such a hybrid model allows human professionals to focus on more complex cases, while the AI system can provide consistent and ongoing care for more straightforward issues. And by working together, AI and human therapists can offer a more comprehensive and effective approach to mental health care. So in conclusion, as the CEO of an AI therapy service company, I'm deeply committed to our vision of transforming mental health care. AI therapists and virtual counseling offer unparalleled advantages in terms of accessibility, affordability, consistency, and scalability. They are designed to fill critical gaps in our current mental health care system, providing support to those who might otherwise go without. And as we continue to innovate and improve our technology, I'm confident that AI therapy will play an indispensable role in the future of mental health care. Thank you.
All right, thank you, Pratiksha. Who is next?
That would be me. Hi, everyone. I'm Leandra, and I'm entering this debate as in the role of a mental health researcher for Team B. And through this role, it's my job to research ways to improve the entire landscape of mental health care. And this could be from trying to improve patient outcomes to improving the system as a whole. So that's kind of the perspective that I'm coming at this from. And I want to approach it from 3 different points, and that includes the data that's being used for these models, the effectiveness of these models, and the risks involved in using this in such a sensitive area such as therapy. So let's start with the data. So commonly for large language models and for generative large language models, a mass amount of data is needed to train and to make them effective. So where is this training data coming from? Because this is such sensitive data, there are 2 parties involved, the therapist and the patient. It's very important to make sure that consent is being used, and it's being used across all different platforms. So this would be something that if AI models were to be used in a therapy landscape, we would want to ensure for safety reasons. Additionally, on top of this, is the data being collected from these models? We know from the use of ChatGPT and other large language models that data is typically collected and stored, even temporarily, on servers to be used in future uses. And for things as sensitive as therapy, when patients may be talking about very traumatic events, they might not be comfortable with this being stored and used later. And it also may start to form breaks in the trust between a therapist and a patient, which could affect the effectiveness of each therapy session. Beyond data privacy, we want to talk about the effectiveness of these models. I would like to bring up the fact that a lot of the existing models that are out there are showing some really good recovery rates for things like anxiety and depression, these more generalized mental health conditions. And that is very important, especially as a mental health researcher, to bring up. The problem is that there isn't a whole lot of data or proof that these are improving other mental health conditions that are also very common, things like OCD, PTSD, bipolar disorder. The use of chatbot AI models in therapy are commonly used for talk therapy, things like CBT or cognitive behavioral therapy. And so can we judge the effectiveness of this being used in a system when it's only effectively being used for a very small subset of the people who would be benefiting from it? Beyond that, there is a lot of worry from a research perspective of misdiagnosis or mistreatment if these are used kind of widespread. One example of this is for conditions such as OCD, using cognitive behavioral therapy or talk therapy is actually proven to make the symptoms worse and to make a condition like that worse. And so when we use these models in large areas, we need to think about the possibility that while it could be improving conditions for some people, it could also accidentally be making conditions a lot worse for people who are in dire need of help. So we would want to make sure that if these models were being put into a system, that there is a good backbone of, are people getting a diagnosis first before they're able to use these devices? Is there a screening process for if these would even benefit a person? And then finally, we want to talk about the risks involved. And three of the risks are to do with hallucinations, unsensitive responses, and emergency situations. So in generative large language models, we know that hallucinations can happen, which are incorrect or misleading results that an AI model may produce. And so you can imagine in a situation where a patient is looking for help, say, I'm looking for advice for how to handle a panic attack. If an AI model were to produce a hallucination and give them incorrect information, this could cause significant harm to the patient. Additionally, when we talk about unsensitive responses, it's been shown an example of a chatbot used in a therapy aspect when a patient was divulging some traumatic experiences they went through in childhood. The chatbot responded with, "That sounds like fun." And so we want to think about, if we think about like ChatGPT, when these insensitive responses happen, they may not be in such sensitive situations, so it may not cause as much harm. But for something like a therapy chatbot, we would want to make sure that these insensitive responses don't happen. And finally, the last area of risk, a very important one, is in emergency situations. So typically between a therapist and a patient, if a patient was showing that they may cause harm to themselves or others, an emergency protocol would happen, another health professional would come in and take over and make sure that they weren't able to cause harm to themselves or others. For these chatbots, we would want to make sure that that is also in place so that patients still are not at risk of causing harm. I will kind of conclude this by saying that as a mental health researcher, it is important that we look at all angles and understand that there are definitely places where AI can benefit therapy, but we can't blindly put this into place without thinking about all the possible risks and the ways in which it can harm patients who are already in a very a place of need. And that's it.
Thank you. Who is up next?
Hello, it's me. As I play the role as a psychologist who use the AI. Yeah, I think the most problem as the CEO see is that we are lack of resource. For example, in NHS, they have some case for that the patient at waiting for about two years to get the service about mental health. It's too long. So I think at least the AI can be an alternative choice between the waiting and also there the AI. I think we are also lack of the enough people to deal with all the case. For example, the budget is hiring about 10 doctors, but actually they are nine, so they didn't get enough positions now. My on to mind, I will respond the questions about the data safety. Actually, in the UK and the European, it's okay for AI. They are already released the law, which called General Data Protecting Regulation. That means they will take the method to protect the privacy about the citizen and so if the fruit or something abuse the privacy or sensitive data, it's not allowed. But yeah, I agree with that. In the USA or something other place, the similar law didn't come out, so they still got the problem. And for the effective, I think the point of effective, I think the first thing is that the we also as a therapist and a psychologist, we also use the AI. For example, we use the NLP to analyze our conversation between the between the therapist and the patient, and trying to find out which part can really affect you. Because before that, we find some kinds of conversation really work, but some didn't work. So for us, I think that can help us about this to improve that, and also the effective about the uh about the patient. I think at least they can give them some emotional support that can make him feel better, at least for the mental health. They got some benefit. And for the guarantee about the react the incorrect generation information, I think for those there's that depending on which case, for those cases that make really dangerous risk, for example, they asking for the suicide or something, or hurt themselves. At the case, for example, the replica, if they detect something like that, they will stop the using the AI generation, replaced by the script. That means they will show the fixed information and make sure everything is correct. So I think don't be worried about that. But in several cases, for example, they sharing their unhappy experience or the horrible day, yeah, the AI might be say it's interesting. So in this case, I think they still need to improve that. So this is what I think. That's all. So for conclusion, I think at least the AI not only used for the patient but also used by therapists and psychologists. And in UK they already approve two kinds of AI of in the mental health. So I think we can't stop it. It's already the realist, but I'm agree that they didn't perfect. We still need to improve that. Thanks.
Thanks. Who's our next speaker?
Okay, thanks everyone for the great discussion till now, and I would like to continue my colleague's introduction as a psychologist in this conversation, and I would like to address my concerns by asking some questions regarding this AI-assisted therapy tool. So first of all, I think that as a psychologist, I should emphasize the importance of fully informed consent when we are using patient data to train this kind of AI systems. And it's not just about the legal requirements, it's about maintaining the trust and confidentiality. So how can, or it's better to say, how do we ensure that these kind of AI tools respect these principles when they are handling sensitive therapy data? Also, I would like to mention the risk of data breaches could seriously impact someone's job prospects, like insurance rates or personal reputation. Another thing is about the effectiveness and limitations of AI in this kind of therapy issues. AI tools like Listen have they have shown good results while they're using for anxiety or depression. But their effectiveness with complex disorders, like for bipolar disorder or BDP, is still unproven. So mental health treatment requires a deep and nuanced understanding that is something AI might not fully achieve. And so this limitation raises serious questions about the overall utility of AI in therapy. Another thing is about the value of having human connection in therapy. So because the connection between a therapist and the patient is really crucial and is essential for healing and personal growth, the AI's 24/7 availability might seem beneficial at first, but it can really replace the empathetic understanding that like comes from human interaction. This is one of my most important questions. And so this dependency on AI could, I think, also prevent genuine emotional support. Another thing is about in therapy, quick human judgment is in most cases needed. So especially while you're in crisis. So if, for example, if a patient is in danger, a human therapist can take like immediate life-saving, for example, actions. But AI's current approach of like directing users to self-help resources might not that much be enough. So how safe is that system? This is my another question. And the last question is about the problem with like the AI errors, because AI systems more or less can sometimes produce hallucinations or incorrect responses. Like for example, a chatbot mistakenly like responding with like humor to a traumatic story. So these errors are not just mistakes; they can like deeply hurt someone relying on AI for mental health support. So in conclusion, I think that the heart of therapy is a special and caring bond between a therapist and their patient. So I think that these relationships, it's really help to people truly heal and grow. So furthermore, I should emphasize on this part that in emergencies where like quick decisions are really needed, AI often like just suggests general help guides that are not enough. So humans can like make faster life-saving choices that are more vital. And I think in conclusion, when we are like using AI, and while these systems have some benefits, they cannot replace the importance or like important things that only human can provide, like for example understanding, like making ethical choices, like forming deep emotional connections. So these human qualities are essential from my side as a psychologist for good therapy. So AI should just help support therapy, not like take over it. And so we should focus on using technology to improve this therapy, not replace the like personal care that's it's a core of helping people heal. So I would like to like know more about your solutions after I told you about these questions. Thank you.
Thank you, Pizza. I believe Lauren.
Hello everyone. Can everyone hear me?
Yep.
Okay, perfect. So I'm representing the role of the patient who has used both traditional in-person therapy and AI-assisted therapy. So first I will address the strengths on our side, or the questions we could have for the other team, and then I will follow that by addressing your questions, Vita. So first is the strength of accessibility in AI-assisted therapy. So foremost, it can be shown to reduce stigma. So for example, some people will not seek out traditional mental health support for the avoidance of human-to-human interaction because they may feel stigma. So AI or online therapy would take away this barrier. Secondly, as we've talked about before, we talked about mentioned bias. So again, with stigma, maybe the patient may feel less judged with AI-assisted therapy, as well with bias, clinician bias, like some disorders are underdiagnosed. So for example, autism in women is severely undiagnosed and misdiagnosed because of bias or a lack of education. So AI-assisted therapy could help with recognizing these patterns. Secondly, we've seen in research that AI-assisted therapy can also reduce barriers for underrepresented minorities as well, and can be more accessible for people logistically since it's online, and also reasons of lack of financial resources for people. Additionally, AI-assisted therapy can help reduce wait times. So for example, reducing wait time can result in supporting more people. We've seen that Limbic currently supports 20% of England's population and their mental health needs. So that helps with over 150,000 referrals. So overall, our point with this is we want to democratize these therapeutic resources, and we really support the notion of radical accessibility. The second strength we want to address is the efficacy of a lot of these apps and services. So again, talking about Limbic as an example of an AI chatbot, it's been shown to save clinicians time and can also help prevent clinician burnout. So my role as a patient, that serves in my interest because preventing clinician burnout has been shown to prevent clinician mistakes, which again improves patients' health. And again, like the reduction of wait times and the efficiency of these apps can be, the reason this happens is because they can quickly screen referrals, collect patient data, and again, reduce wait times. And finally, I want to talk about more accurate diagnosis. So it's been shown for some generalized disorders, AI seems to be better than humans at diagnosing some of these diseases because it can learn from these vast data sets and recognize these patterns better. So that's one point that AI-assisted therapy can be used in just like the initial diagnosis. And this is with mainly talk therapy. So it can synthesize these language patterns to also help diagnose. So moving on to addressing your questions that you pose. So for example, a potential lack of empathy. So as you were saying, unlike humans, chatbots don't have these cognitive capacities such as empathy to deal with behavior or maybe like specific nuances of language the patient might be using. So lots of chatbots, because of this, have some built-in fail-safes. So for example, if someone were to express self-harming thoughts, they would be redirected to self-help resources and crisis helplines that are more specified to deal with this. So for example, you mentioned the question of how 24/7 care might be detrimental because it might create dependency. However, how AI-assisted services have implemented it, it's not for dependency, but rather for prevention if something is available 24/7. Such as a clinician might not be, this will help prevent and complement rather than the patient to depend on it. Next, we want to address the question of data protection and user confidentiality. Although, of course, there's still a lot of work to be done in this, there are still some jurisdictions that have taken active efforts to address this. For example, the EU has very strict data protection laws, and the UK is in the process of implementing their general data protection regulation, and this can help safeguard users. And finally, again, one more time, addressing your concern of more complex disorders. So we want these AI-assisted services to primarily deal with talk therapy and generalized disorders and to complement the physicians and clinicians and help them patients be referred to more specialized care. Thank you, everyone.
Thank you, Lauren. Kevin, I believe you are wrapping this up for us. Just
Hi, can you hear me? Sorry about that.
yeah, no, you're
Okay, no problem. So I'm the third person in the team B, which has a pharmaceuticist. for pharmacists. So on medication. So first I would like to address our to address some several key points about as of pharmacists data privacy concerns about the pharmacist and then I will also and effective and also some risk while using AI, and then I would like to answer the question of the team A's point. So maybe for the one using AI in medication, so there is a significant risk of the personal data that cannot be adequately protected when suching like we inform the person's like age, previous diseases, and their previous drug prescriptions. But even there, it has some privacy by law that it just creates some sensitive information. But for the all over the information for like the ages and the diseases, like something like that, it cannot be completely protected. So it may be have some leaking for an individual or group of people, and so even without their consent, because while the patient using AI, they cannot fully inform and even realize that their personal data is being used. So and that they may not consent to their private information to the AI system as a training data. So this lack of transparency, we cannot avoid it while using AI, as we know that I think the current law didn't forbid that things as a training data. So and even worse, if this data leaks may create maybe so as now cybersecurity, which so everyone may be vulnerable to cyber attacks, so which may leading data breaches where so the sensitive information is accessed by the hacker or some unauthorized individual. So we also need to find a way to prevent that. So before applying AI into the therapy, So second things I would like to emphasize is the effectiveness of the AI in AI medication as a pharmacist, because as a pharmacist, every patient exhibits their unique symptoms, which requires a more personal approach for their medication. So while patients need access to the pharmacist, especially for the very first time, so pharmacist plays a crucial role to determine the most appropriate drug or other or diagnosed for patients. So they would like to consider specific health conditions and history, because the training data are nearly used from the previous history. Maybe most of them are correct, but we cannot guarantee 100%. And then even if it's not correct, maybe it may have some some catastrophic consequence for the individuals. So as this time, so pharmacists, so we are essential in ensuring that we choose the medication which is safe and effective for any individual. And then for the next time and for the second or third time, that they can revise it based on the symptom that the patient used after the patient used the drug, and then and the so overall, I would like to summarize that there are several risks of using AI in medication, like the patient cannot cannot fully realize their symptoms, even for the person who is not who didn't go to the college to receive education. So they cannot fully understand this complexity. So while they're using AI, maybe potentially like to negatively to have their treatment or other conditions. And then we also and also maybe the negative impact of the misinformation if we misuse that information or disease disease without a consent or some or unrecognized matter, so we cannot so this this is very it could create an incorrect medication. And then the last thing is the cybersecurity threats. If our data is used by some unauthorized person, then I think then may like our like sensitive data, not limited, not including but not limited, like some DNA sequences and something else, maybe maybe it's not a very which is harmful for person. And considering about the cost of the AI, but if we get paid from less from the pharmacist, then and other researchers, then we may not create a new drugs to better assist to better assist the new patients. So it may do harm to the scientific research. Thank you all.
Well, that wraps it up. I think these were a lot of great points raised. Great job to all the speakers. Thank you for your preparation and presentation.